Hi there, Marco Lamb here for Freya Health. I wanted to talk with you today about a question that a lot of women have been asking us about polycystic ovarian syndrome. Polycystic ovarian syndrome affects about 10% of women in their fertile-bearing years and about 90% of women who have irregular cycles. 90%, that's a big number. Let's rewind a little bit and talk about what's going on here. When a woman is born, she has 1 million to 2 million eggs, and that's all the eggs she's going to get her whole life. By the time she's of menstruating age, she has about 400,000 of those eggs. And we can think of those eggs as being developed by the follicles in the ovaries and being released, and then goes down the fallopian tube to the uterus to meet with sperm and then implanted on the side of the uterus if a pregnancy is to happen. Now, all of this is mediated by hormones. We can think of the hormones as messengers telling the body when to start growing that egg up and then when to release that egg. And what happens is that the hormones, that special communication within our body gets disrupted by all sorts of things: stress, diet, chemicals in the air, genetic issues. All the hormones can be influenced by just a whole myriad of things. And with what happens in polycystic ovarian syndrome is that follicle, starts growing up to release the egg, and then it just sort of stops there. And the cysts that we actually see if people get imaging done are actually all these follicles that have started growing but then got arrested midway through their growing. It's sort of like if you had planted a seed and then it gets to the sprout stage but never goes beyond that sprout stage. And so in a way that all these little cysts we see around the ovary are all these semi-sprouted follicles. And when these follicles semi-sprout, what happens is they get left there and then they start producing androgens. And androgens are a hormone that causes all sorts of changes in the body. A lot of times you'll see irregularity in the cycle. Sometimes you'll see facial hair, weight gain, acne. And each of these different symptoms in Chinese medicine is treated slightly differently with different herbs. So women may not have weight gain, but a lot of women who are overweight have a high tendency toward polycystic ovarian syndrome. So a lot of the baseline treatment in Chinese medicine is a lot of times resolving the diet. And a lot of times it's taking out simple sugars, simple carbohydrates, eating vegetables, eating organ meats, eating whole grains, cutting out all soda, cutting out all caffeine. So one of the principles in Chinese medicine is a lot of times food is your medicine. Can we treat things as naturally as possibly first? But if polycystic ovarian syndrome goes on for long enough, a lot of times these hormones are flooded in the system for a long period of time, and then we see more longer-term health changes. And particularly, this is one of a big cause of infertility. It's not the only one, but it's one of them. So the doctors will order imaging and then sometimes give drugs to try to restore the cycles. But a lot of times that's not the strong point of Western medicine, and then they'll send you off to assisted reproductive technologies, IUI, IVF. But we can think of these seeds that were planted in the follicles are for a long time. This is a long growing process. So a lot of women who have polycystic ovarian syndrome, even when they go through assisted reproductive technologies and cycle their cycles with hormonal intervention and fertilize and implant an egg, a lot of times those eggs are not the most viable ones. And highly prone to miscarriage, highly prone to the egg not taking, highly prone to the retrieval of the egg not being healthy or not being viable in the first place. So this is, in addition to huge emotional upswing with all the hormones taken through the assisted reproductive technology, there's also the added expense of spending tens of thousands of dollars on this reproductive intervention, and then there's a high chance of failure. So it can be very heartbreaking. One of the things that I recommended for people who are challenged with PCOS is first do everything you can with your diet. See a local acupuncture. There's a fair amount of research that, especially out of Europe, that women have been treated very effectively with acupuncture for restoring the menstrual cycle and restoring ovulation, and the data and the science is there. Now, if we add herbs onto that, there's a lot of specialized herbs that you would take if you have PCOS. A lot of the herbs traditionally in Chinese medicine are in the damp draining category. And these herbs, particularly if a person is overweight, will help them maintain healthy weight. But this is only in concert with healthy dietary changes. Now, the Freya formula is designed to create healthy hormonal flow. So it helps those messengers that influence the follicles to come more into balance. But if the PCOS had been there for a long period of time, I really highly recommend that you see a Chinese medicine practitioner in your local area, as well as take a hard look at your diet and see what you can do to change in your diet. If you have questions, please post them below, and I'll do my best to answer them. And Freya is safe to take while you have PCOS, but I don't always know if it's sufficient. Usually most of the patients I see are taking Freya and usually taking one or two other herbal formulas to correct some underlying hormonal imbalances. Thank you for your time, and hope this is helpful for you.